Welcome to the Geisinger Metabolic and Bariatric Surgery Program. I'm Tony Petrick. I've been the director of the program here at Geisinger for now more than 20 years. At Geisinger, we had actually one of the first medical bariatric programs in the country, and that was followed by a minimally invasive bariatric surgical program that's been recognized as one of the national leaders. Our objectives today are going to be to describe bariatric surgery and why it's helpful to treat many of your medical conditions. I'll describe some of the procedures that we do. I'll introduce you to our surgeons and describe the pre-surgical process. We'll talk a lot about your responsibilities after surgery, and we'll answer whatever questions you have about bariatric surgery. Once we're done here today, you should have a clear understanding of not only why you have bariatric surgery, but what the procedures are and how to stay safe and healthy after the procedure. So now let's look at some of the medical conditions that are treated by bariatric surgery. These conditions can get better, you can reduce your medications, and sometimes they can disappear completely. And you can see it really covers the entire body. So if we start at the top, things like migraine headaches related to high pressures in your brain get better, stroke risk goes down, heart disease, coronary heart disease, diabetes, high cholesterol, and hypertension all improve after bariatric surgery. When we look at your liver, there's a condition called non-alcoholic liver disease. That's the second leading cause of liver transplants in the country. Many of our patients experience that. That can almost disappear in some patients after bariatric surgery. There are certain types of skin conditions that improve. Bone and joint conditions, knee replacements and hip replacements are common in our bariatric patients. We can actually get you to those replacements more safely or even avoid them in some patients. Cancer risk. Believe it or not, cancer risk for almost all cancers goes down after bariatric surgery. If we look over here, cataracts can get better, your lung conditions can get better. Many of our patients wear a mask called a CPAP mask. That's to make sure they can sleep safely and breathe safely. A lot of those patients will no longer need that mask afterwards. Gallbladder disease is one that can actually get worse. When you lose weight rapidly, you may be a little more prone to gallstones, and we'll do some things to monitor that very closely for you. Pancreatic disease, things like polycystic ovaries and infertility can improve. Patients can become much more fertile, be more likely to have children after bariatric surgery, which is also helpful. And certainly venous disease, things that you see the spider veins on your legs or the very large varicose veins, these don't progress and sometimes can improve after bariatric surgery. Now let's talk a little bit about the pre-surgical process. We call our program Nutrition and Weight Management, and that's actually a series of dietitians, bariatric medical specialists, and behavioral health specialists who will help make sure you're prepared to get the most out of your surgery. Preoperatively, the medical evaluation is done by one of our fellowship-trained bariatric medical providers. These may be doctors, they may be physician assistants, and even our dietitians. They will make sure that whatever medical problems you have, they are treated as effectively as possible to lower any risk that they could cause complications after your surgery. Most insurance plans require 6 months with our medical team. Not all of them. And we can get people to the operating room in some of our programs as quickly as it is safely possible to make sure you've had a complete evaluation. The behavioral health or a pre-op psych evaluation is done by one of our psychology providers. They look at some of your habits around your eating and certain addictive behaviors that are related to eating. If you smoke, they will help you to stop smoking, which is imperative before your surgery. And if you have a prior psychiatric diagnosis, anxiety, depression, or any of the other diseases, that does not prevent you from being a good candidate for bariatric surgery. Once you've completed this program, you'll get what we call our green light. All aspects of the program, they must give you a green light. Sometimes they'll give you what's called a yellow light, which will mean you just have to work on a few things. But once you get there, then you're ready to move on and meet your surgeon. So once you have that green light, you move on. The way that's done is a message is sent to surgery, and you'll get an appointment with one of your surgeons. The appointment with the surgeon and the surgery date will get set at that visit. So let's talk about some of the requirements you need to meet before surgery. Your surgery will be postponed if you don't meet certain goals. And we talked about tobacco. It's very important that you stop tobacco at least 2 months prior to your surgical referral. Patients who do smoke, we will do what's called a nicotine or a cotinine test. There are several ways to do that. If you're on a nicotine patch, for example, we have ways to test to make sure you're not smoking, but that we're not picking up the nicotine from the patch. This does include smoking, vaping, as well as chewing tobacco. And a lot of our patients will come in and vape and say, well, we don't have any nicotine in our vape. The problem with this, though, they're not FDA approved products, and the vendors can put whatever they want in there and advertise whatever they want, and there is really no oversight. And we've had many patients who vape non-nicotine products who actually test positive for nicotine. We'll also ask you to lose a modest amount of weight before surgery, and we'd like to see you keep it off. Now, if this really is not possible, despite all your best efforts, we're not going to delay the surgery and the health benefits indefinitely to help you lose weight when you're really having trouble doing it already medically. Finally, you got to complete all your tests that we've ordered, and these will vary depending on the medical conditions you are. And then we've got the green lights and we're off to surgery.